I've nominated Theresa for a Heroes Award because I'm constantly impressed with the energy, creativity and resourcefulness which Theresa puts into planning and facilitating CPD opportunities for staff. She consistently goes beyond the expectations of her role, often engaging with activities in her personal time to develop learning opportunities to enhance the learner experience. Theresa is a passionate advocate of blended learning approaches and can often be found trying out new types of simulation in order to support staff's engagement and interest with CPD. She draws on her extensive experience of working as an occupational therapist in mental health services, and her approach to facilitation is firmly based in providing the most contemporary evidence to equip staff with the knowledge and a range of practical tools to improve the service user experience.
I think I've been nominated because I've used quite a lot of innovative ideas in the training to revamp all the training that I currently cover. So in mental health training that I deliver, I've been using a lot of simulation to ensure that the staff get an experience of what it may be like to experience a particular learning challenge or mental health difficulty. And also we have tended to change the training to make it much more experiential. So again, there's a real mix of different activities rather than just someone stood at the front teaching. What's really important about this job is being able to be creative, to be able to be supported in the job, to do the job to the best of your ability. And without Alex, I couldn't do this job. She has been an incredible support. She's given me loads of opportunities to develop the courses. She's given me a lot of freedom and creativity within that. And I just could not do my job without her. So thank you, Alex, for nominating me.
I nominated Claire as she and I both work as admin for school health. In June 2014, System 1 was instigated across our service. It was decided that the admin staff didn't need training. Well, of course we did. Claire took it upon herself to find out all she could about System 1 and cascade it to all of the community clinics. Not just her own clinic affecting her own job, but cascading it to the 8 other clinics, making sure all of us that worked in school health were up to speed with System 1, were able to implement the systems well, where she was always on the other end of the phone to help us if we had a problem. She's never ending in that. If we ever have a problem, she's more IT literate than the rest of us, and she's so willing to share that knowledge with us and to make sure we're all working to the best of our ability.
I feel incredibly proud to be up for this award. It's amazing that all of my colleagues have recognised the work that went into a very big system, and it's just nice to get some recognition for that. I have a huge knowledge of System 1 and get a lot of questions from various teams, so it's just nice to be able to help anyone that needs that.
The package that they are responsible for developing and delivering addresses the needs of all care staff, whether it be health or social care, to support and manage people who are living in the community who have difficulty with swallowing. This is an incredibly important aspect of our work. As speech and language therapists, we would assess people and recommend how they would best be safe in managing their eating and drinking. And this team's role is to provide information and guidance and practical skill support for the staff and carers who are going to be looking after those people on a day-to-day basis. So it's a symbiotic relationship between the speech and language therapy clinical service and the dysphagia training team.
I think we've been nominated because we have a magnificent training product that's been developed over many years. We get exceptionally good feedback from all the attendees at the training, and that feedback reflects changes in working practices that really improve the lives of patients in the area.
I personally get a buzz every time somebody books onto the training, that they have the confidence in our product to do that.
We're kind of a strange combination of different personalities, and our different skills just seem to blend really well to create a strong, cohesive team. The informal feedback we get on the day is often that we've opened people's eyes, carers' eyes, to something that they hadn't thought about before. They get a chance to be in the place of the patient they're looking after, which really often changes their view on the care they deliver every day.
I want to say that over the last 2 years particularly, I have had the best time working with them. I sit in the same office as them, and it's a pleasure to be part of that environment where we're constantly talking and developing and enjoying each other's skill, ability and company.